everybody. So I'm Dr. Solène Quang. I'm a surgeon and the founder of the startup Hack Your Care, and I'm really happy today to be with you guys. Yes, I was today, because I'm both a surgeon and entrepreneur. I was doing surgery with a patient today, because 1 hour ago I was in the operating room. And one of my patients, it was so hard to extract the cyst, because I'm an oral surgeon, so I used to extract wisdom teeth, but also mandibular bone cyst. And this guy, he has such a hard bone, and I was like, I didn't see that on my X-ray before that. So how could I do? Yeah, I think AI tool today in X-ray could be very interesting. I'm using AI tool to help me to find the better way to do the surgery, but there is so many parameters. And I think, Vincent, maybe what are your thoughts about the clinical decision support today?
Maybe I have a word to introduce myself.
Yeah, of course.
Okay, so Vincent Bouvier, I'm CEO of Vidal Group. So Vidal is a group that is providing clinical decision support, what we call CDS. So we are mainly focused on CDS about prescriptions, how to prescribe drug safety. And we provide this service to healthcare professionals through software applications, medical applications in France and in different countries in Europe. We work with most of the application provider in Europe and also in the US, by the way. And this is what we're talking about. The CDS is relatively new, emerging expertise. We, as a provider, we are already using AI in different ways to build and to shape our CDS. We've been doing, machine learning, deep learning for many years to shape the data that are running our CDS. And now we are using GenAI in the same perspective. Particularly in production today, our teams are using GenAI for the drug-to-drug interaction modules. They are grabbing and organizing the information that they find on the everywhere in the medical literature, thanks to GenAI. So it's already extremely important in our process and in the way we're working. That was a short introduction.
Thank you. Thank you very much, Vincent. I just read this article yesterday from German Network. I think you saw this one. That's both LLM and medical decision finally can be better than only medical and conventional decision making. Because, yeah, what's the use of the AI? Finally, it's maybe the most important. If you have a medical doctor who don't know anything about AI, finally, if you have this kind of tool in your hand, you cannot do better. What do you think about it? Can you explain and present yourself?
The question everyone has on his lips is AI better than human, right? To share you an experience I had, like 4 years ago, we made this study with Hôpital Saint-Joseph, trying to figure out the amount of adverse drug events, so basically medication error due to misuse of drug prescription. And we asked pharmacists in the hospital to review. They do it every day, and review every prescription made by the doctors. And the results was astonished. 40%, around 40% of prescription were not following the good practices. So basically, potential error. Of course, they are not very severe, most of the cases. whereas when we use LLMs and we combine different algorithms that use the knowledge base that we have on drugs and give them the ability to deep dive into the healthcare, the patient record. The AI do some mistake as well, but what, 10, 15%? So is it better? That's the question. So why are we not using it every day, every time? Like the technology is good enough to be better than a human. But I like the idea of Florent from Roche. The challenge here is the adoption. It's not the question that is it better than human, is how the human can use it to make better the decision. So even if we have this 10 to 15%, it's not the question. The question is how is the human making better decision with AI?
Okay, thank you for this explanation. And Vincent, about this landscape, this changing in the clinical decision support, what are your thoughts about? What are your work about?
Yeah, the big change that we have today in this field of CDS is not the proper CDS. It is more about how to feed the CDS. I mean, what is very new at the moment, and I would say the revolution that we assist today, is the revolution of patient data. What is new is that all the medical applications are now, and thanks to these new technologies, will be able more and more, as our doctoral colleague just explained, to gather more and more patient data, to organize this data in different perspectives in order to feed the CDS. And that makes a difference, and that is what is going to change completely the way the healthcare profession will work, thanks to our systems. Just a quick example, 10% today of the patients in this room are suffering from renal insufficiency, 10% in the general population in Europe. And in addition, people more than 80 years old are 100% insufficient. We are not able to adapt the pathology of the drug we prescribe to this person. Tomorrow morning, having just a measurement in the patient record of the renal function, we will be able to adapt the dose that we prescribe to this person transparently. I mean, healthcare professionals will have this transparently, will come as a suggestion for them, just because we have this data in the system. So you understand that even more important than the CDS itself, which is quite simple, is having the data makes the difference. So that's what's happening now.
Yeah, thank you for sharing this huge thing, because the data is today, as we say, the really most important things for innovation, because when you are working on an AI project, you need some physician, some patients' data, and also obviously some LLM or So maybe how do you do to help healthcare practitioners finally to organize their data in a private cabinet, for example?
So yeah, at Theodo we develop a tailor-made AI solution, and when we do that for our clients, we face multiple challenges. You said it. Now we have the data; it's available. We just have to feed it to an LLM to make it work. The problem still is interoperability. Basically, there are the roads of data are not here yet. It's very sketchy roads. It's getting better. We have Mon Espace Santé coming out. Ségur V1, V2 is going in the right direction. So the next part is working with healthcare professionals. So we are working with the CIO to make the data roads, and now we have to work with the practitioner to think of the. It's not just the AI. You have the AI, use it. It's an experience. Where does the AI go in the workflow? Currently, when you do the surgery, is there a Jarvis? You can, hey, I have this problem. Can you help me? Is it in the healthcare record, the dossier passant? It's on the software. So we have to work with practitioners to understand what's the new experience to develop. And I think Dr. Lieb is doing it a lot. So yeah. We have to work with you.
Yeah, and actually, because I'm clearly a technophile surgeon, but I'm, for example, because I'm working in Paris in a private practice, and I'm working with entrepreneur friends on a private warehouse. I will think that there is a huge role for physicians to organize the data, but a lot of them don't know how to do that. They don't know sometimes what the data are, that can be from the SAS, but also from for example, in my practice, the X-ray. So how you organize everything could be very helpful for a physician like me. And then, obviously, you can work on the valorization, monetizing maybe them. It's really interesting maybe to work in the same time for the adoption of all these data sets. Yeah. How do you do?
So we can help you organize as an engineers. We can make the sketch, but we don't understand anything about the data. And this is what's so difficult when working on such solution. It's really easy to work on maybe CRM or e-commerce website data AI around this stuff because we understand it. We are consumers. We are not doctors. I cannot do engineering school and and medicine school. Maybe some does. What LLM help us as well is to enter your world. I can ask what is I don't know T cells. Okay, explain it like I'm 5. Mm-hmm. It helps a lot to make sense of all this data and make a data set that we will use as an engineer to develop such solution. That's really the key, the collaboration here with practitioners and engineers. And it's really difficult to work with you guys because you have no time.
No time, of course, but you have to interest ourselves. Do you want to add something, Vincent, about it?
No.
So I was... Yeah, we agree with that. That's why I think the key is to help physicians to understand data, AI, but maybe, and what my idea is to because I'm also the founder of this startup HackYourCare, which allow physicians to participate to mission with company and mostly AI company, because I've done that since my residency. I was working with AI company to annotate data sets. And I really think it was so interesting to understand how it works and to speak with engineer like you. And that's why there is a really huge place for physicians to work with AI projects, annotating, but also maybe with generative AI. For example, we are producing content, and with Vidal Group, we are working on this to allow and to facilitate the work between physicians and companies, so they can work together faster, better, stronger. That's our timeline. So, what?
A comment on that, and maybe you can add. When we started annotating data with practitioner. It was funny to see, as an engineer, I wasn't aware of that there are no basically consensus everywhere. Like when we ask, okay, what's the correct answer to this question? Like, what are the side effects of this molecule on that? basically everyone agree. But when we say what's the best way to treat this patient, the LLM will answer a question, and we have to evaluate, is it the right answer or not? And when we ask practitioner, is the LLM right or not?
Say no.
We don't have always the same answer. And so it's also a side effect of that is to see that we can build consensus by building AI that will also spread what are the good practices, what the consensus is. And I think you mentioned that last time. What's the balance between I do like my personal practice and how we spread the good practices, how make something homogeneous, you know?
At least what I can say is one of the big objectives of the CDS is to standardize the practice around the best practice. And that's our goal.
Yeah, so yeah, I think to answer our question today, it's that in your case, we need some physicians. I'm always speaking of physician first, sorry. Patient, but data of patient, and I really think physician can help to organize the data because they can help to understand the patient why we have to use the data also. And yeah, we need some tech guys like you, entrepreneur, and yeah, maybe building new warehouse kind of in network to personalize this kind of AI tool.
Yeah, and a nice perspective on that. It's all about data access and having this new framework, the European Health Data Space, that will give keys to share this data in a okay way. Like we will be able also to collaborate even more with patients, with practitioner on the European level. So I think it's really good perspective. It's not going to be, we won't see that maybe 5 years maybe, but I'm really happy to see we're going that way because we cannot do the same way in other countries.
Thank you very much. I think we just finished our time and we love to be the perfect team today. Thank you.
Thank you.
Thank you very much.